Good morning, everyone. Happy Friday, and welcome to the California Collaborative for Long-Term Service Support's monthly webinar, first one of 2021. So happy New Year. Glad to see all of you here joining us. We're really excited today to have a panel to talk about the Master Plan for Aging, which is something that the Collaborative has been working on and talking about for many years, and been very excited since the governor's announcement that he was going to have a master plan for aging, and many collaborative members and many folks participating in this meeting have been intimately involved in the development. So we're very lucky to have a star panel of folks who are really knowledgeable about the master plan and what has been in there, and have been helpful in moving it forward, and will continue to be helpful in making sure that it's implemented effectively and really does make the changes that we're hoping to see with this comprehensive master plan for California. So lots of exciting updates. We're gonna kick it off with this great panel, and then we'll talk about some local master plan for aging events. And then we will have an advocacy portal training. So full agenda today. So I'm gonna go ahead and just quickly introduce our panel and then jump on in. So we have Kevin Prindiville, who's the Executive Director of Justice and Aging, who will be leading the panel and moderating today. Donna Benton, who's a Research Associate Professor of Gerontology at the USC Leonard School of Gerontology and Director of USC Family Caregiver Support Center. Susan DeMorris, who's Director of Public Policy for the Alzheimer's Association. Maya Altman, Chief Executive Officer at the Health Plan of San Mateo, and Peter Hansel, Chief Executive Officer for CalPACE. So join me in welcoming them, and I will hand it off to Kevin to get things started.
Thanks so much, Athena. It's wonderful to be with you all today. It's a very difficult and stressful time in our country, I think, but a very exciting time for aging in California. We're coming out of and continuing to deal with a tremendous crisis and the COVID crisis and the impact that's had on our state. And I think that there's a lot of optimism with the new master plan for aging about a more proactive and engaged way that the state can address the COVID crisis and ongoing opportunities and challenges as our demographics of our state shift, like the country and the world, and we grow older, and how we embrace that and utilize that and leverage that to create a better California for all. So we're excited to be here with you today. Just as a little bit of making sure everybody has the basic information about what's happened. On January 6th, the governor did release his master plan for aging. The release of the plan came after over a year of very active stakeholder engagement. There was a stakeholder advisory committee that had been meeting for over a year to develop recommendations for the plan. There was numerous other stakeholder engagement opportunities through work groups of that committee, public forum, a website gathering input, all of which was run by the California Department of Aging. And all of that information was taken and sort of used and then molded and filtered and shifted through. And the governor released his own master plan for aging based off of those recommendations. And as Athena said, you've got a group of us here today that were heavily involved in the stakeholder advisory committee and a lot of the work that grew out of that. So we had all of those tremendous recommendations. The Stakeholder Advisory Committee submitted a big comprehensive report of our recommendations. And like I said, the governor and a cabinet working group that they had put together then developed this governor's master plan for aging. And that master plan for aging has 5 bold goals, what they call 5 bold goals. And then 100 different initiatives that they plan to undertake under each of those goals over the next 2 years. So the 5 bold goals are: goal 1 is housing for all ages and stages. Goal 2 is health reimagined. Goal 3 is inclusion and equity, not isolation. Goal 4 is caregiving that works. And goal 5 is affording aging. And then in addition to the 5 goals, the state has also created a data dashboard that's going to be tracking progress across these 5 goal areas. These goals are similar to the goals that were created by the Stakeholder Advisory Committee, although a little bit different. So if you've been tracking the recommendations of the Stakeholder Advisory Committee, there will be a lot that you hear about these goals, and as you read the plan will be familiar, but they've been reorganized a little bit, which reflects, I think, deep thinking that happened within the Newsom administration and within the cabinet work group, really their effort to put their own thinking and their own stamp on the ideas that were collected by stakeholders, which I see, and I think most of us see as a positive sign that they're taking some ownership of these ideas. So that's sort of where we are. And like I said, we've got today a collection of us that were heavily involved in the stakeholder process that led to the development of this plan. And so I'm going to kind of turn now to facilitator mode and start to ask my fellow Stakeholder Advisory Committee members their impressions of the plan. And I'm going to start by asking each of you to just quickly give me a letter grade. What would your letter grade be for the master plan for aging? And then I'll come back to you and I'll give you a chance to explain your grade a little bit. But let's just start first with grades, and I'll start with Donna. What grade would you give the master plan? You're on mute, Donna.
I'm going to start with a B+.
Okay. Maya, what would your grade be?
Hey, mine's B+.
All right. Susan, what would your grade be?
A-.
Oh,
And Peter, what would your grade be?
Well, I tend to grade on the curve, but I would say an A-. So.
Okay. All right, Donna, explain your B+.
I think because there's still room for growth, there are some areas and gaps that are still there that weren't fully realized that came out of the initial recommendations. Overall, I think that because it is a 10-year plan, we have to really look at the growth. And of course, with COVID, I think that some of the plan was scaled back, particularly in the area of long-term care services and supports. We're missing things around transportation, and I think that we could build stronger on the caregiving goal in terms of definitions.
Great, thanks, Donna. Maya, what about your B+?
well, I'm a hard grader. I'll start there, but I think that on the plan is a wonderful framework, and I really love the fact that the cabinet took ownership of it, as you said, Kevin. I think many of our recommendations are reflected, and there are some real strong commitments in there for things that can't be done right away to do them for the long term. I guess the two areas I'm most concerned about, and Donna touched on this, was LTSS, long-term services and supports. I do like the fact that they kind of integrated that under Health Reimagined to bridge health and LTSS, but I think a little bit was lost under that too. And when you think back to one of our three highest priorities as a SAC was fixing long-term care and fixing LTSS, I think that's I think we have to bring the spotlight back on that in a much stronger way.
Great. So Susan, now we get to the easy graders. Maybe Susan with the A-.
So I chose A for Alzheimer's because, A- because it's unprecedented to have Alzheimer's named and visible in a report such as this anywhere in the nation. And Alzheimer's still, people with Alzheimer's and their families still suffer from under recognition and tremendous stigma. So just that single act of putting Alzheimer's prominently in the plan definitely deserves an A grade. The minus, I think, would be that, for those of us who worked on it, the major issues, the system change, the transformative work still needs to be done there. And I hope that a lot of these committees and groups that are formed and processes that will continue will give us that setting and that forum that we can really tackle some of the structural issues that we need to fix.
Thanks, Susan. So Peter, what about your A-?
I guess I'm one of the easier graders. So I'm in the A territory, I think, because of the breadth of the proposal, as you mentioned, Kevin, and the outline of the vision and the goals, even though they were transformed a bit from what came out of the stakeholder process. I think they got it right. I honestly think they hit almost all the boxes. in terms of goals, whether it's initial steps on access to LTSS, housing stability, income stability, some things about caregiving, equity, and so forth. So I'm looking at it as a living, breathing document, not a static document. So I'm kind of looking at the vision, and that's what leads me to say an A, or close to an A. I think the faults, if any, or shortcomings are, I think as noted, is really not as ambitious maybe as it could be out of the gate. I think in the access to LTSS area, there's certainly a lot of things that that are not incorporated as immediate goals, whether it's improving Medi-Cal eligibility, dealing with the asset limit, asset issues. The LTSS benefit issue is sort of punted to the federal government. So I think in that sense, I would tend to maybe bring it down a tad. But overall, in terms of vision, I'm pretty impressed.
Yeah, great. Thanks, Peter. And I guess as moderator, I think I'm supposed to answer some of these questions too. So I'm going to cheat a little bit as moderator and say at my kids' school, they actually do split grading. So there's a grade for sort of study habits, then a grade for the actual substance. And I think the plan gets an A+ on the study habits side. The amount of engagement, the working through, taking time to pivot to the COVID crisis, and then also continuing with the plan, and just the amount of effort that went into this at the stakeholder level and the cabinet level, and that Kim McCoy-Wade did at CDA. So there's an A+ for the kind of study habits, and I think I'm in the B to B+ range for many of the same reasons that others identified, that we've got a great framework here, but there's still a lot of detail to be filled in, and especially work that's both very specific and targeted, and then also continuing to do the work on the big picture, the kind of big ticket items, both in cost and impact. So the next question I had for you all was, what are the 2 to 3 specific initiatives? So that this plan we talked about has goals, and then it has over 100 initiatives. So what are the 2 to 3 initiatives that you're most excited about? So I'll go reverse order this time. I'll start with you, Peter.
Well, despite the fact that it maybe is not as ambitious as it could be in a number of areas, as others have said, I do think in the access to LTSS area, there are some important first steps. And as a service provider, which is really what PACE is, in the HCBS continuum, if you will, there's some really important concepts that get immediate attention that we're pretty excited about. The expansion of the no wrong door concept, making it easier for people to connect with services, I think is woefully overdue, and is a major step forward. There's funding attached to it in the CDA budget, which I think is exciting. They are hedging a little bit on out-year commitment on that funding, but if we keep our fingers crossed and lobby effectively, hopefully we can continue that. I'm excited about the HCBS roadmap concept, which the state is taking a step forward in using grant funds to under the Money Follows the Person program to start mapping out where do we need better HCBS, what kinds of services and where. And we definitely have some things we'd like to contribute to that. And then I think the bringing in the concept of Medicare innovation and integration, I think is a game changer. I think it's really the first time the state has even put that on paper, I think, which just embraces the idea that we need to be thinking more broadly of the population that is facing problems accessing LTSS. And that's certainly Medicare beneficiaries in the state. There's really not the state's responsibility for the most part historically, but the fact that they've made a commitment to create an office and work with the federal government and really explore demonstrations and flexibilities. And there's some that PACE can tap into or make available, I think. So very excited about that. I'd say those are my 3.
That's great. Thank you for being so specific to particular initiatives too. If you have it in front of you, could you even call out the numbers of the initiatives?
Let's see.
You don't have that right in front of you, but that would be helpful, I think, for people reading along at home.
Okay, sorry. 98 is no wrong door. Medicare, Medicaid innovation, 34. And the roadmap is 40.
Great. So 34, 40, and 98. Great. Thank you, Peter. Next, I'll go to Susan.
All right, from the Alzheimer's Association perspective, all of the first 2 or 3 fit under the Health Reimagined section. And we have some catch up to do in our state. As I mentioned, less than half of people have been formally diagnosed with a diagnosis in their medical record, and a lot of families are just adrift in the system. So for us, it's first things first. Recommendation 64, which relates to screening, detection, and care planning. People need to be put on a pathway to learn about services and access services and benefit from services. The second would be recommendation 55 around geriatric training. The sheer numbers in our state, and we've seen this recently with COVID, that our workforce is already limited in our state, physicians, nurses, social workers, and we can't train our way out of it, by producing more. So we need to build the skills of people already in the workforce. Physicians, especially primary care physicians, need geriatric training. And then the last would be number 33, the universal LTSS benefit. This is on a longer term horizon, but with the families we work with, this is absolutely an equity issue. Who can pay $25 an hour for home care, and who can pay $5,000 a month cash out of pocket for assisted living, or $10,000 a month for a nursing home? So we're deeply committed to the universal LTSS benefit.
Yeah, great. Thank you, Susan. And again, good job picking really specific initiatives. So Maya, you're next.
Okay, sorry, I was searching for my initiatives because everybody set the bar so high here. I agree with Peter on the Medicare Innovation and Integration Office. I think there's tremendous opportunity there, and I'll just put a plug in for the duals integration, which I think the state could do a much better job with going forward. And I think building more Medicare expertise within the state is extremely important. That has been lacking in the efforts. But I have to mention CalAIM. People have feelings about managed care. I understand that. But the governor has committed more than $1 billion to CalAIM. That's where the money is. And so I think we as a community have to figure out how to hold the state accountable and how to hold plans like ours accountable to really delivering on the promise of CalAIM. And there is tremendous promise. So that's initiative 36. And there is something called In Lieu of Services, which is a terrible name, and JC committed to coming up with a better name, JC Cooper, the Medicaid director, but it gives plans the flexibility to really deliver non-medical services, which are so important to helping people stay at home and helping people age well. And so I think that has a lot of promise. There are also something like, I can't remember the exact number, but like $300 to $400 million of incentives that are set aside. And what that means exactly, I don't know, but I think part of that is that the incentives for health plans, if they commit to building infrastructure in their communities, and that would include LTSS infrastructure. So I think, again, we really need to learn how to use this opportunity to the fullest. The last initiative, and I couldn't find the number, maybe it's in the Alzheimer's sections, and I can find the number in a minute, but and it's something very specific, which I feel strongly about, which is coordination models with IHSS for people who can't self-direct their care, people with dementia. And I just see that in our own membership as such a huge need. And so I'm looking forward to working on that.
Great, thanks, Maya. So Donna, what are your 2 to 3 favorite initiatives?
Okay, so clearly I'm looking within the caregiving realm, and initiative, it would be number 108, which has to do with assessing participation in state paid family leave and including legislation for equity been working on that for many years, and I think that we have an underutilization by family caregivers because the system is so difficult to use. So I think that that's number one. The other piece that we want to look at is 109, which are the options to include family caregivers in home and community-based assessments. The caregiver resource centers have been committed to doing that for years. And we would love to collaborate with the Alzheimer's disease, not the Alzheimer's, the ADRC's initiative, so that we can use we have a lot of good tools that are already there for looking at assessment, but making sure that once someone's assessed, they have to know if it's for caregiving, they need to be handed off, a warm handoff to the specialist who can work with family caregivers and make sure that they are use all of the tools that can help them continue their caregiving experience. And so that's number 109. Then also under there's the virtual care expansion. And we started the care expansion and having the options and looking at innovative models. And so we want to be able to bring forth the innovative model that's being used under the current system for the statewide CRCs, and really that has a good alignment along with races, ethnicity, and looking at the whole strategy. So I think those are the three that I really want to expand, along with 115, which is the telehealth method, so that people can really reach out and be able to support the care receiver and the caregiver while they're using these different telehealth modules.
Great, thank you, Donna. And you all did such a good job of being so specific to initiatives. And as I was listening to you, and you were all very convincing about why they're all exciting. There is a lot in here. So for our audience, just really the importance of not just reading the goals, but really digging into each of the initiatives. You all mentioned many of the things that we're excited about at Justice and Aging, so I can list some other things so that I'm not just repeating you all, because everything you said was great. But I'll also draw attention to, there's a whole section on housing. I'm not sure which initiative this lines up with, but the budget also included a significant proposed investment in housing for older adults, $250 million for Department of Social Services to acquire some RCFE assisted living buildings and to make those available as affordable housing for older adults. So I think that read in conjunction with initiatives like initiative number 1 on expanding housing production and housing availability for older adults is something we're really excited about. Another one I'll draw attention to that I don't have the number for, I didn't do my own homework, is the Elder Justice Coordinating Council. So this was an idea to put together a coordinating council that includes collaboration across state agencies, input from external stakeholders, so that we can come up with a better coordinated, more comprehensive plan for addressing elder abuse and elder justice issues across the states. And then I'll also pick as my third initiative 129, which is to continue to make efforts to increase the state's supplemental payment for SSI as a key strategy for addressing California's incredibly high and unacceptable rates of senior poverty, and recognizing that really the only way we'll make significant progress there is by putting money in the hands of those that are living in poverty today. So Susan sort of drew attention to, this is more maybe a long-term item, like the long-term care benefits, but it does keep a door open for us to continue to work to identify revenue, to identify other opportunities to address poverty in the state by increasing the state supplemental payment. And we're pushing now with Californians for SSI, that coalition, to include some of this investment even in the Golden State recovery package that's being worked on right now. So we talked about the 2 or 3 things that y'all like most. I think it's important as part of this process that we're continuing to push and advocate. We're also looking at maybe where there's gaps, things that we think are missing or things that we're a little disappointed by. So what are the 2 to 3 things that you think are missing, or where you think we have a lot more work to do in order to get the change that we're seeking? I'm going to mix up the order this time, and I'll start with Maya this time.
Okay. Well, I want to touch on the nursing home issue. I think there's some, and this was in it was strategy F, I think, in the health reimagine area. There's several nursing home related initiatives. With the COVID crisis has really laid bare a lot of issues with nursing homes. And I think that Marty Lynch said this, I think it's true. It's a little light. In this area, I think, it is a difficult area. There's a lot of controversy, a lot of strong advocacy, a lot to do immediately. But I think there's some more work that definitely more work and a spotlight needs to continue to be, centered on nursing homes. I think the good things in there, though, for nursing homes is that there is an acknowledgement that really have to work toward the nursing home of the future. And, looking toward, remember, this is a 10-year plan that hopefully we can have more smaller, more home-like nursing homes, not these huge institutions that, and the other thing that I think is good in there, and I heard J.C. Cooper at the summit yesterday, make a commitment to really focusing on nursing home quality using payment methodologies. So, a lot of the controversies around should the nursing homes be penalized more. And there is in the budget some things for increasing penalties for inappropriate discharges and so forth. But I think the carrot is also really important. And being creative about how to incentivize improvement in nursing homes through payment is really important. That's just one area I just wanted to devote some time to. And then just real briefly, I think another area which I was disappointed, unless I missed it, I didn't see anything about oral health in there. That was a pretty big area of recommendations in our report, and I just didn't see anything in there. So I'm concerned about that.
Thanks, Maya. I'm going to go next to Susan.
Okay, so I think what I'll, well, first I just want to say, I think this plan is very comprehensive, and there's nothing I don't like in it. It's all good. So I do think we got really close to the mark in terms of touching on things that are most important. Something that's playing out now with COVID, traditionally the public health system has not been really a part of aging and disability services, and they have a key role to play now, the 58 counties and the 3 city public health departments, and we saw it with testing and PPE, and now we're seeing it with vaccines. So I think, from a consumer perspective, there are bits of it in the plan, but reconciling are we a county-based system? Are we a statewide system? Are we regional? So navigate, we can have an 800 number and a website, but for people on the ground, they don't always understand that there are 33 planning and service areas. They don't know that, the way things are organized according to government. So really, looking from the bottom up, from the care, from the beneficiary or the care recipient or the older adult or person with a disability, how they view the world. I think we did a great top-down look, really good top-down look.
Yeah, thanks. That's an interesting perspective. Thank you, Susan. Donna.
Yeah, I would say in looking at where I'd like to see a little more is, we've heard about Build Back Better. And I think that the plan in some ways, we have some very strengthening of some systems, but I think that there's some systems that could still be invested in more. And continue with our adult daycare programs, our programs like MSSP, building programs like the CRCs. So programs that are already there that may right now need to continue it, and stabilization. It's not always clear what we're stabilizing. We're adding to some, but we're not necessarily building back what we had and innovating in those areas. I think there's opportunities to do that in the plan, but it's not give it out where you can really understand it. The other thing, of course, is I went to the data dashboard. And so I'm really seeing that there were a lot of placeholders in the data dashboard right now. So for me, metrics and how we're going to measure the data dashboard is something that's one big black box. And still, and I know that it's really very early, but I think that that's where that I would like to also concentrate.
And Peter, what would you think of as missing or places where there's a lot of work to do to get to more detail?
Yeah, thank you. I have to agree with Susan on, I would say our top issue actually at the moment is access to the vaccine, the COVID vaccine. And I do think the plan touched around emergency response in some ways, but didn't really get to the heart of public health emergency and how to manage that. I do think there'll be an effort to try to shore up, improve the infrastructure and system when we get into situations like we've been in. But it's been very frustrating from a provider standpoint, getting access to vaccines both for staff and for participants who are quite high on the scale of need, I would say. I think another thing that is not fleshed out, needs to be fleshed out, is the role of home and community-based service providers like PACE, CBAS, MSSP, and others, particularly in the areas around integrated care and CalAIM that Maya touched on. There's just not a lot of detail, and I think we're trying to fill in the blanks a little bit. I think we need to make sure that these programs get lifted up and don't get overlooked and lost in the shuffle. They have a huge role to play, but they're playing it as sort of providers. PACE is sort of a quasi-provider and a plan. But anyway, we're going to be pursuing proposals, at least in the PACE arena, to try to elevate visibility and awareness of programs like PACE. There just isn't enough information about them out there. It's difficult for people to find their way into them, and the system, the managed care enrollment system, doesn't really help that at the moment. It doesn't really point towards PACE for people who really could potentially benefit from it. So we're going to put some time in that area. Another one is, again, from a service provider perspective, there are some important regulatory flexibilities that service providers have been enjoying during the pandemic to allow them to deliver more services in the home, do it more efficiently. Some consideration of use of telehealth, which has been mentioned. Really would like to see those extended. I think we've learned a lot from our perspective about how to do things better, actually, how to reach people better, how to serve them better, how to enroll them better, and do it more efficiently. And I suspect that's the case with CVAS and other programs as well, waiver programs. And I think we all could be doing a much better job making use of resources in an era of fiscal limits. And so extending telehealth, certainly absolutely critical, and that is prioritized in the plan, so that's good. Making it easier to get referrals into programs from people who could vitally need the services. The state has kind of touched on this concept of trying to do a better job of referral of people who are going through, say, hospital discharge or in nursing facilities who need to get back into the community, but it's just not a very effective system or efficient system. And there's some flexibilities that would really help improve that. One of them specifically for PACE, I'm not sure if we can get this actualized or not, would be some type of mid-month enrollment concept. We potentially have flexibility to be able to accept people in the middle of a month, and that's unfortunately pretty important when you have somebody who needs services and needs them now, particularly if they're coming out of hospital discharge. You can't wait for 2 weeks or 3 weeks for the start of the enrollment period. So that's a specific thing we're going to be working on. And then finally, it'd be nice to see put up some money for startup of HCPS programs, connected to the roadmap idea. Having a map is great, but can we put some limited amount of money out there that provides incentives, startup funding to get programs off the ground, particularly in less served areas? I think this is going to be vital in rural areas of the state. That certainly applies to PACE. So I think a small amount of money actually could help get planning going on the ground to try to build out the infrastructure in that area. So.
Great, thanks, Peter. And I would say for us at Justice and Aging, I think one thing that was missing was healthcare affordability. Peter mentioned this a little bit earlier, but there was a lot of ideas that were presented in the stakeholder process for how we could expand Medi-Cal to make healthcare and LTSS more affordable for more Californians, and we didn't see those ideas incorporated. So that's an area where we plan to work with the legislator to hopefully make some progress in this legislative session. And then I also want to draw attention in terms of something that needs a lot more effort and work from all of us and engagement from the state that I'm sure the state is going to welcome is around equity. Sharing some ideas from my colleague Rigo Sabario at St. Barnabas Senior Services. Really, if you look closely at the plan, there's a lot of good intention around equity, but we need to follow through on that by being very specific about ensuring that we're getting to racial and ethnic equity in how all the programs are designed. And there's some good commitments in the plan initiatives around analysis of how different programs are reaching or not reaching different populations equitably. So we need to follow through with those. And then I think we need to look not just at the programs that were identified for that equitable analysis, but really be doing that type of analysis across everything that's happening in this master plan. So I've got one more question for you all, and then we'll move to some Q&A from our audience today. But so my last question is kind of a two-parter, and that is, what do you plan to do over the next 60 days to stay engaged in this process and move things forward? And what advice do you have for other members of the collaborative or other advocates of what they can do to engage in this new phase of our work together? So this time I will start with Susan.
Okay. Events of late have trained us to approach things one day at a time. So 60 days from now feels, March 15th just feels like a long way off. But, what we're doing is the Alzheimer's Association has introduced a bill, Senate Bill 48, with Senator Monique Limon, that addresses the geriatric training of primary care physicians. So we'll be working on that. And over the next 60 days, we've already seen budget hearings and policy hearings will start. So we, we're just immersing ourselves in this plan. And as I said previously, we support it all. So every opportunity we get as an organization to speak in support of or on behalf of any item that's contained in the master plan, we'll be doing that with the budget committee and the policy committees.
Thank you, Susan. Donna, you're next.
Boy, I so agree with what Susan said. It's a day at a time at this point, but in the field of caregiving, we really are going to concentrate on anything that comes out of the paid family leave area and bills that come from there. Elder justice bills are key for many of our stakeholders, and particularly around building technology that works for family caregivers. So we'll be looking at continued expansion within the statewide CRC system for our technology pieces. And of course, we're going to do everything with the Alzheimer's bills because that's very key for the population who's caring for our dementia population.
Thanks, Donna. Peter.
Yeah, well, I mentioned a couple of specifics. We'll definitely be pursuing proposals around boosting awareness of PACE and trying to extend regulatory flexibilities. We'll also actively support elements of the plan as they come out, particularly around anything that helps with access to LTSS. It's no wrong door funding, getting the roadmap off the ground, creating the Medicare Innovation Office, and so forth. I agree with the points about budget will be a focus. I think that was Liz Fuller's message, I think, in this summit. A lot of the activity around the master plan will be focused in the budget committee, so we'll be pretty engaged, I think, in supporting those proposals as they come through that. I do think this is, there'll be a lot going on. I think perhaps the collaborative could play a useful role in just helping to collect all of the various proposals and track where they are, have ongoing discussion and information sharing, so we're all aware of what's coming down the pipe from where, and give us a chance to educate each other and cultivate support from each other for the proposals, which I think will be essential.
Thanks, Peter. And Maya, what about you?
I just wanted to mention one thing. People have been texting me, and there's a thing in the Q&A that one thing I wanted to say also, just real briefly, that the plan is a little light on is behavioral health. And there is an initiative or a promise to, there's a lot going on under behavioral health, under Department of Healthcare Services, and to have a perspective. And I think Kim McCoy-Wade, the director of CDA, will be joining the behavioral health committees in under DHCS to inject that older perspective, the older person perspective. So I think that's real important, and then there's more work to be done in that area. So I just wanted to mention that. But as far as the next 60 days, we have a strategic planning retreat next Tuesday, all virtual, of course, with local health plans of California, which are the public health plans. And I have carved out some time to talk about the master plan on aging, and I'm to proselytize among my fellow health plans and make the connections between CalAIM and the work of the master plan. And so I will be doing that. I think I'll be working a lot on CalAIM with the department. And I think the latest version of CalAIM is better than the first version. There is at least more language about older adults and people with disabilities, and but continuing to lobby to make sure that that program reaches its promise with older adults and people with disabilities. And then I think for the collaborative, I think local organizing is extremely important. I think that local efforts to set priorities, I mean, even using the framework of Kevin's questions, and it's the framework that Kim used at the summit too. What are people excited about? What do they think is missing? Is a great framework to kind of get at what are folks' priorities to work on. And I think that's really important to kind of diffuse that throughout organizations at the local level as well.
Thanks, Maya. And I'll highlight a couple things that we at Justice and Aging are planning to be working on specifically in the next 60 days is like others mentioned, is engagement with the legislature, looking for opportunities to advance some of the initiatives or address some of the gaps through bills that we can start moving through the budget and the legislative cycle. So that'll be a big one. Another one is the federal work. So as also people highlighted, it looks like there's some potential for some exciting things that would advance caregiving and home and community-based services. And we're hopeful that we'll see federal legislation here in the next 100 days, hopefully, that gets at things like creating a Medicaid entitlement to home and community-based services and restoration of the SSI program. We're not sure that those things will get across the finish line in the next 100 days, but that we'll see at least legislation introduced that is consistent with a lot of what California wants to do, but bringing in federal resources to help do so. And I'll also highlight too that we're really excited for the Elder Justice Coordinating Council. We're really hoping that that's something that's off the ground and having its first meeting by March 15th, like Susan said, even though that does seem so both soon and far away at the same time. And I think for the collaborative, I think the advice that was given was great. The idea of working locally. The master plan for aging also has a local playbook for local advocates to be working with on local issues. And then I really encourage people to dig in, to look at the initiatives. You'll see very few of the initiatives present something that's done. They almost all they have words like identify, further facilitate, investigate, research. So those are all opportunities, one for you to pick one or two, and you and colleagues have meetings with the agencies and say, where are you on this? And if you're mapping, let us help you map this. let us give our input into this. So there's over 100 opportunities for you to ask for a meeting and then to be part of the process that's outlined here as an initiative, right? They didn't say it's 100 policy changes and 100 programs being implemented. It's 100 initiatives. So that's 100 invitations to work on something with state agencies. So we'd like to take some questions from the audience. And Athena, what's the best way to do that?
So I'll go ahead and just start by kicking it off here. We have the Q&A, and because of our experience with the Zoom bombers, I think only the panelists can really see the Q&A. So if you have a question for the panel, please type it in and we'll do our best to get to all of them in the next 15 minutes or so. But I want to thank you all. This has been great. So following on something you were just saying, Kevin, about kind of at the local level, one of the questions or comments was about maybe a missed opportunity to create some partnerships for accessible transportation at sort of a regional, local level. And so first I'll make a plug that we'll be covering this in our next monthly webinar. We have, let's see, we have John Cunningham, who's an expert in transportation planning from Contra Costa County, coming to talk about that. But I'd love to get your guys' thoughts. I see some heads shaking. So Susan, why don't we start with you? It looks like you had some reaction to that as maybe a missed opportunity in the master plan.
I was agreeing with you, but in terms of, simply put, California is one of the few remaining states where when somebody is formally diagnosed with Alzheimer's disease, they lose their driver's license. So that's a deterrent to diagnose. A lot of physicians don't want to be the one to put that chain in motion, but consequently, people aren't able to drive. So that's why I was nodding my head around transportation. And
Peter?
we're looking at it with the vaccine clinics as we speak, how are people able to get to the vaccine clinics?
Yeah, it's a really good
transportation's a barrier.
Yeah, I'd have to agree. I mean, I think transportation has been well identified as a key social determinant of health and outcomes. So it actually has to be up on the list. Most LTSS program to be successful have to incorporate a transportation element. That's certainly true. PACE, there are huge barriers, and I agree. In the short term, immediately getting people to the vaccine sites is absolutely essential. So, yeah.
Okay, others have thoughts on that? Go ahead, Maya.
Well, I was going to say also, don't forget that under Medicaid, transportation to medical appointments of any kind or to Medi-Cal benefits is a benefit. So, you should be hitting up the health plan in your area to make sure that they are transporting people. And I've heard, I think plans are ready to step up transporting people to get vaccinated.
Yeah, that's a really good point. Okay, I know we've got lots of questions to get through, so we'll move on to some of the next ones. So this one actually, Maya, was specific to you and touching on the integration of Medicare and Medi-Cal, given that a lot of the services we're talking about are carved out of the benefit. So what does true integration really look like in that instance? And so we'll start with Maya, but I know others of you have thoughts on this, so.
Yeah, well, I know Sarah asked that question, and it's a great question, and I don't have a great answer. I think the commitment in the CalAIM process to having a work group on what does a managed long-term services and supports benefit statewide in all health plans, which is a commitment to implement by 2027 in CalAIM. What does that look like? And I think it's up to all of us to roll up our sleeves, and it's going to be controversial, but how do we create a robust benefit in managed care? And I don't think there's any, things are carved out today. I think there'll be new things created. I don't think we have to, just say, well, we have, MSSP and CBAS and we have IHSS. I mean, I think it's an opportunity to think much more broadly and think about new services that can be created. And but I think the bridges to IHSS, how those are going to be created through integration. If it's not integration, then how do we achieve it is a really big challenge for us, and something that we do have to resolve eventually. I think there's some I know there's some exciting things happening at a federal level around integration for and ideas, and there may be legislation introduced this year. But it does foresee it offers a lot to states in terms of funding and ability to achieve integration, but it also demands of states that they do more to integrate their services. So I think that's one of our central challenges moving ahead. That's the best answer I can give right now.
Donna, did you have thoughts on that? I thought I saw you.
I was just nodding in agreement. I think that integration is going to be critical. It will make, I always think of the caregiver perspective. It makes it easier for them to understand the entire system, because many times they're dealing with a Medicare system, Medicare, Medi-Cal, or medical system that they don't even understand. And they just know that they have to help their relative get into the system. And so if they're having struggles with it, imagine somebody who may have early stage dementia of any kind, trying to deal with it on their own. So those that don't have caregivers are particularly challenged. So the more that we can have this integration of services, is going to be better for all of us as we age.
Yeah, that's great. Oh, go ahead, Maya.
I just wanted to just add also, I think on the behavioral health side, the integration is so sorely needed. You know, when you have a physical in Medi-Cal program, you have a whole separate system for seriously mentally ill, and it's a separate system than people who have physical health problems and mild to moderate. I mean, there are all these artificial lines drawn that just don't make sense from a consumer perspective. And I think Alzheimer's and dementia always falls to the cracks, because the behavioral health people say, oh, no, that's not a behavioral health issue. That's, you know, a brain thing. And we don't get into that. And then, you know, the plans will, well, you know, so, I mean, they're just these artificial lines drawn that we can't tolerate anymore.
Yeah, I think that's a good point. So Kevin,
Here.
There's a lot of questions coming, and I haven't gone to you yet, Kevin, but just around this, and then specifically about the Medicare Innovation Office, if that offers any opportunity to really think more broadly about this. I know you guys do national work, so any thoughts on how that might work as well?
Well, we're really excited about the Medicare office because of the potential it shows to have elevated strategy around dual eligibles. In our national work, this is something we hear repeatedly, that states just don't have a lot of Medicare expertise. So when they go to design programs and come up with better systems for dual eligibles, they're doing so just without the focus on and understanding of the complexities of Medicare. And so the policy just isn't as strong as it could be. So we're really excited to see the state, you know, double down on its commitment to investing and understanding the Medicare program, so that it can design better programs for those that also have Medi-Cal. I think it's also good that the state is showing some ambition to also potentially use this to develop better approaches for people that only have Medicare in California. I'm a little bit more skeptical about how many levers will actually be available to the state for that population. I mean, the Medicare program is a federal program, you know, so I think we need to be careful not to place too much kind of expectation and hope that there's something out there that the state can do with the Medicare program that it just hasn't done yet. But I think that adding this kind of emphasis on Medicare will strengthen its ability to solve problems for dual eligibles, which is really important and critical. And maybe it does open up something on the Medicare side that we're not seeing yet, but I would just caution us to not get too excited about that, because the state role there is more limited.
Great. Thanks.
Can I add to that, Athena? Just something I see a lot of potential with the Medicare Office of Integration and Innovation is, I don't think we've paid enough attention to emergency room use and hospitalizations, because at least for people 65 and over, it's usually covered by Medicare. And that's a key driver of transfers and discharges and the need for LTSS. And as Peter said, you know, discharge planning. So I hope that the combination of the geriatric emergency room and the Medicare office, that we start integrating the hospital setting and being much more deliberate about avoiding hospitalizations and helping people discharge from hospitals. I hope that comes out of that office.
Mhm. Very good point. So I think we're going to move to a couple live questions. Marty Lynch, are you unmuted? Want to ask a question of the panel? Here he comes. We're going to go a little bit longer because there's such great discussion. So
Okay.
we won't
I
rush
think-
you. Go ahead. There you are, Marty.
I think you got it.
Yep.
Okay. I was interested in of course, good conversation already about the Medicare Office of Integration and Innovation, or Innovation and Integration. But I wanted to go back to the roadmap discussion. I was taken by our colleagues' concept, and great job, panel, about the LTSS area not getting quite the attention that it needs. And one way that it gets attention is this idea of looking at a roadmap that helps us understand the gaps in the current system. Peter may have alluded to it, but I wonder if people would talk a little bit more about how we go from a map that lays out gaps to actually filling in those gaps with either new services, as Maya alluded to, more of the existing type of services, LTSS services, services like PACE that are only available in limited areas of the state. I think the map is a great first step, and then we have to go that next step of having a strategy to fill in the map. So I'm interested in your comments on that. Thank you.
Let's have Kevin kick it off this time.
Marty, it sounds like, you really did say what we need to do, which is filling in the gaps and recognizing beyond the roadmap. But once we have this, the beginning of the roadmap, I think that as we continue to look through the master plan, and that's where I think the members of the collaborative are really going to begin to see at the local level, we'll start to see really what those gaps are. And I think that's what we really have to do. So I think we still have to do the mapping because it's still very, very vague about what's not there right now. And that's going to take a lot more eyes than we even had on the master plan during the 1.5-year process.
Yeah, I agree with Donna. I think it's going to be highlight this commitment, and the state is applying for funding, several $1 million of funding to do this gap analysis, and it's going to show in a very concrete way, particularly in rural areas, what the missing pieces are. And then I think it provides an opportunity for local areas, local legislators, as well as advocates all across the state, to really hone in on here's what we need, and where's the funding, and how are we going to fill this in. I also go back to the statement I made about the incentives plan in CalAIM. And I think maybe even not waiting for the state to do the gap analysis, but to the extent in your own communities what the gaps are, and go to your health plan and say, how are you going to help us solve this locally? So I just would not, I think it's important to do local advocacy with your health plans. They'll probably kill me for saying that, but I think it's really, the public health plans were set up to do exactly this, to have community members on their boards and to focus on local problems. So get them to do it.
Can I offer a couple of thoughts? I think I touched on this area before. I think some incentives for starting up programs, maybe some targeted grants would be helpful. I do think an education campaign outreach to identify potential sponsors of new programs would be worthwhile. I do think there are a lot of organizations that are on the ground that may be able to be enticed to go into the area of LTSS and HCBS, whether it's FQHCs or hospital systems or senior housing providers, aging services providers. This is where PACE comes from. If you look around the state, usually it is one of those types of organizations decides we want to take this on. There's a huge need in the community. But the issue is always commitment and funding. It takes money to get these things off the ground. But you could have some sponsoring organizations that could see it as attached to their mission enough that they would want to go into it, and so with some education and outreach and some startup funding, I think it could happen.
Great, thanks, Peter. I know Nina, you also had your hand raised. We'll hear from you, and then we'll do kind of one wrap-up question, even though there's so much good stuff here, but we do have the rest of our meeting, and I'm sure we'll have more conversations. So Nina, go ahead.
Sure. Hi, good morning, everybody. I actually had 3 questions and a comment. About making sure. I did have a question just about the caregiving assessment that's mentioned in the master plan. I'm unclear if this is pertaining to Medi-Cal recipients only, or if there's thought given to also extending this to non-Medi-Cal. I know the CRCs already do perform an evidence-based assessment, but would just like to hear about this. Should I pause before I go to my next question, or Athena?
Why don't you just say them both, and then people can kind of respond to both as they're going, since we're going to wrap up here in a minute.
Sure. One other thing, just asking, actually, I thought you had 3 questions. Can we please use our listserv to share bill language and fact sheets as soon as they're available, so that we're not all flailing, looking for legislation? It would be really helpful. And we can talk offline about how to organize that so it doesn't become overwhelming. Finally, again, I just urge everybody, as we're thinking about Medi-Cal and, for example, transportation, having a lack of options, just always encouraging us to think beyond Medi-Cal, because there are many people that are non-Medi-Cal that also don't have access to transportation. And we definitely are hearing this this is coming up with even access to vaccination sites. So that's it. That's what I have to say. Thank you.
All right, anyone have some responses there for Nina?
When looking at the caregiving piece, it does look like it's just for what was mentioned under CalAIM. And again, the concern is we keep having that missing middle.
Yes.
And they're kind of invisible. So that's kind of 2 points that Nina brought up. And I think that we do have to know that assessments have to be done not just within that population, but across the board, so that people don't fall into, we don't have to spin down into poverty in order to get services in a comprehensive way.
Yeah, really good point. Thanks, Donna. So I know we're running a few minutes over on time, and I want to answer. I know there's some questions in the chat. We'll try and respond to those over time, and we can also follow up via email, and hopefully have more conversations. We want to kind of round this panel up with sort of a call to action, right? So I want to hear from each of you about sort of what are your thoughts about what the collaborative could be doing, should be doing, that would really help, make these things happen, drive home some of the concerns people have about with the change that really will happen as we implement, and not just having it all, written in a nice report that doesn't actually change the system. So we'll go ahead and I'll start with Susan, and we'll just give us your quick thoughts on that.
Okay, so I think this plan has brought us to maybe the 15,000 foot level, and where the collaborative's already been so helpful. It made this happen. But if we could start getting real life stories for every recommendation, so you're talking behavioral health, if there are real people in real communities that have hit hurdles or could benefit from any of these recommendations, we need to start lifting that up, kind of take it out of the policy arena into the real world. That's where the collaborative can be very helpful.
That's a great idea. All right, I'm just going to go my little Hollywood squares as it shows up. Peter, you're next.
Yeah, thanks. Yeah, I think I offered a couple of points on this, but I do think it would be really helpful for the collaborative to play an ongoing role in terms of trying to track all the various proposals, inventorying them, making this an ongoing discussion topic, so we can continue to educate each other. I do think we need to be focused on the advocacy front, and I know that that's happening in many forums. But when there are key items that are up, helping people to know when they are up, how they can participate, how they can advocate, and bring in the local perspective. The real person, I think, that Susan's talking about, will help make sure that our advocacy is effective.
Great, thanks. All right, Kevin.
Yeah, I think, like I said before, I think adopt an initiative or adopt an agency. There's lots of agencies called to act here. So, the collaborative picking one or two, or having groups that kind of get assigned to one or two agencies and then follow up on the initiatives to make sure the work is happening. I think that's critical. We really open doors here. And so we got to walk through them now and engage these agencies.
Great, thanks, Kevin. Maya?
Yeah, those are all great suggestions. I think one thing I know as a member of the Stakeholder Advisory Committee, one thing, and also the LTSS subcommittee, one thing we really struggled with was setting priorities. And we had hours and hours and hours of conversations. But I think it really helped because, we started off with 800 something recommendations, which, is way too much. And now we're down to 100. But I think it's really important. I like the idea of adopted initiative, but I think it's really important if you can do it, and maybe it's breaking up into smaller groups, but really trying to say, okay, what is the thing you're most excited about? What is the most important thing? I think you just learn a lot through that process, and it really helps, focus efforts too. So I would just, put some consideration to that as well.
Great idea. Thanks, Maya. All right, last but certainly not least, Donna, your thoughts on how the collaborative can take action here?
I think by reaching out to groups that we don't normally have in our collaborative, bringing in across generations and bringing new groups in that you may already have existing ways that you collaborate, but expanding in that way so that we can really see this as an aging for all way of approaching the master plan, because it is cross-generational, it's for all ages. And the more that the collaborative can bring those in when we're looking at advocacy, I think that we'll have a stronger overall picture for us in the long run.
Great, thank you so much. I'm sorry we're running out of time here, but as we know, there'll be many more conversations. I'm sure we'll invite one, if not all of you back again at different times. So thank you again. We're gonna move right into our next panel or our next presentation here. Thank you for your patience, Catherine. So we have Catherine Kelly here from he's a Senior Government Affairs Manager at OnLock and the Bay Area Senior Health Policy Coalition, and really excited to have her give a little overview about some of the work that's being done on the regional level for Master Plan for Aging events. California Collaborative has 20 regional partners that represent over 40 counties in the state, and they are all planning local events that we wanted to share with you all. They're going to take place throughout 2021, starting in the spring. They're hoping to get broad range of stakeholders, elected officials, and discussions, and really bring this out to the local level. So we're here to learn more about that from Catherine. So I will hand it off to you. Thank you so much.
Thank you, Athena. Good morning, everyone, and happy Friday. And thank you so much for the opportunity to share how the Bay Area Coalition is thinking about our master plan for aging events. This is a really exciting opportunity for us to really bring the master plan local to our communities. And so the Bay Area Senior Health Policy Coalition, for those who may not be familiar, it's a coalition of coalitions, and we cover all Bay Area counties, including the North Bay, which is Marin, Solano, Sonoma, and Napa counties. And so for our master plan for aging events, we decided to focus our efforts on the North Bay since they don't have their own designated regional coalitions. And we also didn't want to duplicate events that are going to be happening in other Bay Area counties. So that being said, the service areas of OnLock and CEI, who are not only the coalition leads for the Bay Area Coalition, but two of the Bay Area's PACE programs, we don't reach into the North Bay. And so we needed to think about how can we bring these events to communities that we aren't as familiar with compared to our own service areas. So in order to put together an event that's most relevant to those communities, we reached out to organizations who are serving seniors and adults with disabilities in the North Bay to see if they'd like to partner with us, kind of get their expertise on shaping the agenda, but also to help us get the word out and invite their audiences. So we have connected with groups such as the Aging Action Initiative, Marin Center for Independent Living, COVIA, and the Marin Commission on Aging. And what we found is that these groups are not only incredibly excited to partner with us and to host events on the master plan in their communities, but some of them have already held events last year on the master plan. So this will actually very nicely complement the work that's already underway in the North Bay. For the events themselves, we are hosting them on Zoom webinar. We made the decision to move forward with committing to doing virtual events, just given the uncertainties of being able to do in-person gatherings, but wanting to commit to holding these events this year. So we are hosting them virtually. Our goals for the events are going to focus on the local impact of the master plan and make them as interactive as possible, given the fact that they will be virtual. We're planning on hosting 2 events this year, tentatively planning for them both to be 2-hour webinars over Zoom, but half of that time will be in smaller breakout rooms because we want to provide as much interaction and discussion as possible for the attendees. The first event, we are planning to be just kind of a level setting for the master plan, but want to focus on the local playbook and include remarks by stakeholder advisory committee members, have those interactive breakout sessions, and really tease out what issues are most important for these communities by working with our North Bay partners. We're planning the first event for April to also tie in with any relevant state budget and advocacy opportunities that may be available. The second event that we're thinking about is planned for the fall, and that event we would want to provide updates on the state budget, implementation of the master plan for aging, and also how attendees can really continue to stay engaged as this rolls out. So we are convening a planning session with our North Bay partners within the next month. What we've learned so far with planning these events is that utilizing the local playbook is going to be a really great resource for us, and the timing of this is just perfect in terms of our planning for the playbook to have been released. And what we've also found is that reaching out to groups who you may not normally have a lot of connections with, or you may not be familiar with their work, has actually provided really, really great opportunities for partnership and then also shared interest around the master plan for aging. So that concludes my overview. I'm happy to take any questions, and thank you again for the opportunity to share our work.
Great, thank you so much. Do folks have questions? So first question is, how will these sessions intersect with the network of age-friendly communities?
Great question. So that is actually something that we are going to talk with our North Bay partners about at our planning session meeting. That's definitely a key area that we think there's a lot of overlap with the playbook, given that many of these communities, Marin especially has a very robust age-friendly network. And so we definitely want to figure out how can we tie that in, but look to their expertise of, what are the areas that we should really be focusing on that will get attendees excited about attending, but also make these very relevant to the ongoing work that's already happening.
Great, thanks. And Nina said to feel free to reach out to AARP. They have led several regional roundtables, so to make that connection. One last question is whether you can mention the organizations, the 3 organizations you're working with, and what counties.
Sure. So the organizations who we've connected with are the Aging Action Initiative, which focuses on Marin, the Marin Center for Independent Living, also Marin, Marin Commission on Aging. COVIA, they have services, and I apologize if any of our partners are on the phone. I can't recall it off the top of my head. I believe they do go into the other counties. We have also connected with the County of Napa, And then also Ombudsman services of Alameda, Contra Costa, and Sonoma counties.
Great, thank you.
Thank you.
All right, well, look at Catherine was able to get us right back on time. So thank you so much for that great information. And please do pay attention to these regional events, really helping to get the word out at the local level and engage some of those local stakeholders and politicians. So we will move on to the last part of our agenda here, which is an advocacy portal training. We had some of this around our advocacy day, some beginnings of sort of how to better utilize our advocacy strengths here at the collaborative. And so there was a request for some follow-up on that and some additional training. So we are lucky to have Patty Prunhuber, who's a senior housing attorney with Justice and Aging, here to give us a little bit more information on that and run through the advocacy portal. So I will pass it off to Patty.
Thank you, Athena. First, raise your hands, breathe. You've been sitting in a chair for an hour and a half. This is going to be a lightning quick training, and we've been working at this very high level about policy and initiatives, and this is going to be a quick and dirty. How do you access the website? How do you submit your letter? Why are we doing this? Because it's super important. And I'm going to wait a moment. I think Nancy or somebody's going to give me my slides. Is that right? Or should I call them up myself and share my screen?
Hey, Patty, I think you can pull them up yourselves. Let us know.
Okay,
I wasn't
prepared for that. So just give me 1 second then, and I will do that. Let's see. Here we go. All right. Let me get the let's pop this up. All right, I'm hoping you can see that. Is that right?
We can't. And I think Nancy actually has the deck ready to go if you'd like us to share, and you can just say
sure, because I have that it's showing as number 1.
Sure thing. There they are.
Great. Okay. So this is just going to be very quick. You all might be much more expert at this, but I'm just going to lead you through the basic steps, and other people can feel free to either chat or add some comments. Just very basically, why are we doing this? They're super important. Legislators and their staff, committee members and their staff read these. They register our concerns. It often leads to further dialogue about how to make a bill or measure address those concerns. If you're planning to raise concerns, not just to support the letter, support the bill, but actually oppose or oppose in part or support only if it's amended, it's really, really important to reach out to legislative staff before you submit the letter. They hate getting blindsided by this. And it gives you an opportunity to negotiate meaningful changes. And sometimes they'll say, well, we can't do it for this hearing, but we'll do it when we have before our next hearing, when we have a chance to amend. So the rules for submitting letters are very clear. They must be submitted at least 5 business days before the scheduled hearing. My experience since we've started having the portal is that they're not always that strict about the business days, but it's better to err on the side of getting it on time. If it's an organization, you have to put that letter on your organizational letterhead. Has to be signed by a person who is authorized by the organization to sign. So it's good to, if you're a sort of a volunteer or something with an organization, make sure that you have authority to do this. And when the portal first came up, many advocates with legal services and people who worked with a lot of low-income groups and client advocates were very concerned that this could be a barrier to participate in democracy, that it would be a barrier to actually having your views heard. So they've tried to make it both more accessible And also many of the committees will accept a paper letter, or even by mail, or even hand delivered, if that's the best way for a client who doesn't have access to the internet to get something in. And so I'm giving you here the link, and I think these slides can be shared, but I could also put this later in the chat box, or somebody could do that for me. It's the way you get in, and then they have a really good FAQ at the bottom of that portal entry, and it answers a lot of the questions that I'm not going to go over here, because these are the things that might go wrong, like what happens if my letter is rejected. And I think it'll answer a lot of the questions that you might have. But here's how to start. You go to the position letter portal that I just gave you in the previous slide, and you either sign in or you create an account. So I already have an account, but if I didn't, I would go to create an account right at the bottom there, and then it will lead me through the questions. And if you have questions as we're going, do feel free to put them in the chat box, and maybe Athena, you could let me know. Are you a registered lobbyist? I think for most of you, the answer is no. There's a set percentage of your time, if you are spending that engaged in legislative lobbying, then you have to register with the state. It's part of our sort of Sunshine Act of knowing who is actually getting paid to do lobbying. Do you represent an organization? And for many of us, the answer is yes, but you can file a letter as an individual. You do not have to be associated with an organization. I put in my organization, Justice in Aging, and it shows up in a drop-down menu. If you can't find it, go to the FAQ, and it tells you how to create a new organization, client organization. I think that's FAQ number 6. So there's step-by-step procedures for how to do that. Okay. So then you go into it says, do you want to submit a letter? And you first select a bill or measure. So these are not limited to bills. You might do it on a House resolution or a Assembly or Senate resolution. You might do it on a budget bill or budget initiative. You might do it on something that the governor is putting forward, and it can even be on a measure to amend our Constitution. So they're all different kinds. You pick, you go through, and the most common ones you will see is AB, which stands for Assembly Bill, and SB, which stands for Senate Bill. You put that in the first drop down, and then you pick your bill number. If you don't know your bill number, there is a way to use the CalLeg info to find bill numbers, but I think I'm going to assume that the coalition is going to do a really good job in its Google Doc that it's going to share with everyone with all the bills that we're tracking so that you can find it there. Is that I hope that's a fair commitment. So I just picked a bill that is important to older Californians who are facing homelessness. It includes funding for homelessness prevention and getting people housed. And it is a $5 billion ask. It's a very big ask, and it's being sponsored by Assembly Member Luz Rivas. So I picked the bill number, and it shows up. And there might be more than one that show up when I do the first drop down. So it does a search, and then I pick the one that I want. And then I go to the next screen. And this is all to make sure that your letter is submitted in the correct portal entry. Okay, here's a bunch of steps that you're doing. So you have now selected the bill you want to comment on. You then go to select your client, and that is, in my case, I'm picking my organization that is my client. And then it says, who gets this? Select recipients. And when you see that, you'll see that the committee staff and the author's staff are usually automatically checked, but you can make sure that the letter is getting to everyone that you think it should. And sometimes initially we saw that these were not all available. And so I would, in addition, email it to my author's legislative director, just to make sure that if the portal wasn't getting her the letter, that she would have it. Then you do your select file, and this is just a matter of uploading your letter. And the first thing you have to do is pick what's your position on this letter. And they've expanded the options. There are now 5 options. You can support, which means I just want this to get passed. Oppose, I don't like it. Support if amended, then you want to say what the changes are that you're asking for, and oppose unless amended. Some committees only like oppose unless amended. So the support if amended is new. And then I've never used other. Oh, sorry. And then you write the subject, which could just be the bill number, and then you choose your file. And this is where it has to be a PDF. And so I assume you all know how to convert a letter in Word to a PDF, and make sure that it's got a signature on it. Has to be signed. And then you choose that file, it uploads, and you hit submit. What if after you hit submit, you say, oh my gosh, I submitted the wrong letter? Then you go to, can I delete a sent letter on the FAQ, which is number 9, and it tells you to contact a committee member. Let's see, I can tell you exactly what it says. Contact the committee office. So there are ways, if you make a mistake, to fix it. If your letter got rejected for some reason, this has never happened to me, but again, they're going to encourage you to contact the committee office or reply to the email that you're sent. For example, if the hearing's already over, you might have a rejected letter, and see what the committee has said in its email. Let's see, so it's pretty simple. Even though we had a lot of concerns when this portal first came up, it has ended up being very handy. One of the things that it has, which is very nice, is you can see all the letters that you've submitted. You go into manage my account and you can see the history of everything you've done. And I find that really helpful at the end of the quarter when I'm trying to say, gee, what have I been working on? What's my advocacy activity? I can go and see all the letters that I submitted. So that's quick and dirty what the portal, how the portal works, and how it can really help you in your advocacy. And I think I did that in under 15 minutes, which I promised to do.
You did, and you had somebody already write back and say thank you. They've used the portal before, but this step-by-step overview was really helpful. So
okay, great.
Thank you for that. I know we are just right at time, so I want to thank everyone today. We had great panelists, a lot of good information. Thank you, Patty, for doing that quickly. And thanks to everybody for participating. And again, reminder, we have our next meeting on February 19th at 9:30, and we will send out information on that and promote it on social media. So please share and join us, and happy Friday. Have a great weekend, everybody.
Do feel free to share the slides.
Oh, yes.
With the
screenshots. We will. Sorry, I didn't mean to say that thing. We'll be sending out the slides, and the chat function's disabled, so we'll send out the links and the slides.
Great.
Thanks, everybody.